Thanks for joining us once again on our Health Minutes. Health Minute, we'll see wherever it goes. Joe DiMatteo of the Ask the Pharmacist Group. What's going on with young children? Use of medications, adolescents, taking adolescents all the way down to 5, 6, 3, 4-year-olds. More and more medication. Let me read you a couple statistics. Twofold increased risk, cardiovascular disease, Journal of Adolescent Psychopharmacology, a Danish study. Twofold increased risk of difficulties and problems and complications in over 700,000 children that were studied with ADHD, arrhythmias, high blood pressure, emergency room visits. So we see spikes, huge increases in the use of medications for attention deficit hyperactivity disorders. And it seems like the rate of attention deficit focus hyperactivity is certainly on the rise, hence more medications are being used. Over the past decade, this study ended, I believe it was about 2011, so we're a little behind. But over that span, roughly 2000 to 2010, five-fold increase in the use of attention deficit medications in children and in adolescents. A Danish study showed that over 60% of their population with ADHD was on some form of medication to treat. Approximately 20% of all autistic children were on medication. The use of psychotropic medications in children and adolescents skyrocketing. The rate of diabetes with these atypical antipsychotics on the rise. Comorbidities. The more meds that young children use, the more potential for adverse events and adverse reactions. More meds, the summary of the scientific piece said, less talk therapy, less interactive, we're not engaging children. My perspective would be to take it another level. What about the diet? How many colors and dyes and preservatives are we consuming? How many pesticides? Links directly to organochlorines, pesticides, herbicides, and attention deficit hyperactivity disorders. Direct corollary, can see it. Number 3, dysbiosis. What about imbalances of good and bad bacteria in a lot of these young children? So just some real basics. What are they consuming as far as food goes? Number 2, what types of foods? What are the secondary ingredients, the pesticides and the herbicides? Third, what about the balance of good bacteria in their gut? What about essential fatty acids? What about just getting children on good fats and oils, getting them on probiotics, getting them on more of a whole foods diet, getting them on multiple vitamins, help them methylate better. I've done various teachings on methylation pathways. Most children in this arena, not all, have a genetic disposition epigenetically where they don't methylate well. They need to be on the right forms of folic acid and B12. We have a great product called NeuroKids. It's in a liquid form, tastes great, has dimethylglycine, helps children to methylate, do the work and process of methylation more efficiently. Skyrocketing use of psychiatric meds, attention deficit medications. We're running into a lot of complications. It's on the rise. It's not on the decrease. Thanks for being with us on this Health Minute. See you on the next one.